Thank you again for everyone who's joining us today to learn about the clinical experience at the University of Western States. The University of Western States Diversity, Equity, and Inclusion mission is something that I want to mention before we launch into this presentation. So UWS is committed to building a community that reflects the diversity our students will encounter in their professional lives. And that includes in your clinical portion of the program. So your clinical training will come from diverse instructors, and we'll be treating a diverse group of patients as well. Bola Majikobaje is our Director for Diversity, Equity, and Inclusion. So if you ever have an opportunity to meet her, I really hope you get a chance to. She's phenomenal. But also if you run into any questions or issues on our campus, she's a great resource to reach out to. So the clinical experience at UWS, what does it look like? When you first start your clinical experience, you'll be in our campus health center called Connected Whole Health, whose motto is, "You are the center of our care." And here's just some views of the clinic. So this is the clinic reception and front desk. Some of our treatment rooms, the fitness center and rehab room, and then our laboratory. And this is our Connected Whole Health team. So these are the chiropractic clinicians who are going to supervise your training while you're in the campus health center. And we do offer off-campus community engagement events as well that you can participate in. So the Connected Whole Health Clinic is led by our Chief Medical Officer, Dr. Bill Moreau. And for anyone who hasn't met him yet, Dr. Moreau was the leader of the medical services for the US Olympic Committee. He worked with both Olympic and Paralympic teams and was responsible for the care of thousands of Team USA athletes. So he was the Chief Medical Officer for the Rio and Pyeongchang Olympic Games, as well as the medical director of the London and Sochi Games. So while you're in our campus health center, if you come across any complex cases that you and your clinician find really challenging to treat, he's an excellent resource and will definitely be there to help you. And then Dr. Bergstrom is your clinical supervisor in our campus health center. She began her career at UWS in 2018 as a clinician in the campus health center. And then in 2021, she moved into the supervisor position and resides there. Dr. Bergstrom worked in private practice for 16 years prior to shifting her focus to the instructional side of chiropractic. She graduated from Northwestern Health Sciences University of Minnesota with her Doctor of Chiropractic degree in 2001, and then St. Scholastica University in Duluth, Minnesota with a Master of Arts in Management in 2004. And beginning in 2002, she worked as an associate before starting her own practice in North Dakota in 2007. And in 2012, she moved to the Pacific Northwest and thankfully decided to join us. So without further ado, I'd like to introduce Dr. Bergstrom, who's going to speak to you a little bit about the clinic.
Thank you, Natasha, and welcome everybody. Thank you for attending and learning about our clinical experience here at the University of Western States. To start off, your first 2 years at UWS is more all classroom, first year all classroom, but you do learn some techniques. Your second year, you're learning a little bit more. You get into your preclinical sciences. All these are going to prepare you for learning your history, your exam, adjusting techniques. They all get you prepared. You get these little bits of information before you then are able to put it all together within the clinic. In quarter 7, you will spend some time in a class called Clin Phase. This presents you with 3 opportunities to be with a standardized patient. And these patients are trained to mimic a patient. And then you get to have the opportunity to just perform all that you've learned into this one patient. So history, exam, going through the adjusting process. You will also learn in quarter 7 documentation. So you'll learn how to use our electronic health records and prepare you more for the clinic. You will shadow with a clinician throughout the weeks 6 through 10 as quarter 7. And this gives you the opportunity to see the flow of the clinic, possibly get to take notes for one of the students that are treating a patient, and also get to work with the clinician on what are the best practices for note taking, what they see in taking notes, and maybe corrections that they see that the students need to be made when performing a patient encounter. In Q8, that's when you will start your clinic experience. And as Natasha said and showed you the photos, this is in the Connected Whole Health Clinic. There are 6 clinicians that you will be dispersed between. There's a morning shift and an afternoon shift, and that is from 7:30 to 6:30, split in half throughout the day. During the clinic experience, you will bring in patients. You will also have the opportunity to treat patients that call in for appointments. We take all insurances. We do work comp, we do motor vehicle. The clinicians are all trained to provide you with the instruction to treat these patients. You will also have the opportunity to receive free care here yourself. Your family members also can receive free care here under the direction of the clinician. You can treat your family, or you can have one of your peers treat your family. It's up to you either way. During your treatment, we have many modalities that you have the opportunity to utilize during your patient encounter: laser, ultrasound, interferential therapy. We have a really nice rehab room, as you saw in the photos as well. Each clinician kind of has their own little niche of what they do with each patient. Some are more rehab orientated, others are more pediatric, others are more nutrition. So it does help to get to know kind of each of the clinicians, even though you're supervised by one, because it could add a different aspect to what you're going to do for a certain patient. And that's completely fine. We're all a team here. We also have a more new modality is we've been using a lot of class 4 laser, and our most recent is extracorporeal shockwave therapy. These have been shown to produce great results with different conditions such as plantar fasciitis, more chronic tendinopathies. And if you don't know these conditions already, you'll get the chance to learn about them through your clinic experience here as well. The biggest thing, I think, in my position right now is just to really be engaged in clinic. Bring patients in if you can. I know some come from different states, different provinces, different countries, and so it's difficult to have that group of family here. But if you meet somebody, say in your apartment complex or at the grocery store, just try to get as much experience as you can. Practice as often as you can. You can really tell those students that really are dedicated to that, because it really makes them more confident throughout their whole experience. When you get your Q8 and Q9 are going to be mostly in the campus health center clinic, Connected Whole Health. When you get into Q10, you have the opportunity to do a community-based internship. We also have compassion events and a community clinics that you can spend time at. I'll explain a little bit of each of these. Natasha mentioned Dr. Morrow. He is one of our CBI doctors, and you can spend time with him on campus. He has a wealth of information. That one can be started a little bit earlier in Q9. You do interview for that process, but there is an interview process for that, but it's a great experience to see more complex cases. We also have currently about 34 clinics within the Portland metro area that are willing to provide or willing to take on an intern for their community-based internship program. This then is in place of your clinic shift. So what you normally do if you were a morning shift or an A shift, or a B shift, you would then just go to those clinics and fulfill your obligation of clinical hours in that clinic. We also have the compassion events are more weekend events. That is when we go out into the community and help, such as Compassionate Connect is one. Salvation Army is another. We offer free care to the community, and it gives the students just a really good opportunity to provide free care. And to those that don't normally get the opportunity to maybe come in for chiropractic services, those are, you sign up for those and you're chosen. You can do 1 or you can do 4. It just depends on how many we have that quarter. The community clinics, those are run by Dr. Owen Lynch. These are quarterly assignments. So Fora Health, Cascadia, Men's Volunteers of America and Women's Volunteers of America are our current community clinics. Those two, you spend, most of them are 1 or 2 days a week. So you would be in your clinic on campus here with your clinician the days that you aren't at that clinic. But those are also really good opportunities. You also have the opportunity to be part of the VA. These are rotations that you begin in either quarter 10 or 11. They usually are 2 quarters, and we currently have about 12, I believe, VA opportunities. They go anywhere from Seattle, Portland, over to Ohio, Cincinnati, I think is the location for that. That is run by Dr. Stan Ewald, and those are really good opportunities to serve for our veterans. And that also can turn into a residency program as well. So if you wanted to stay on with the VA, you would have that opportunity. We also have a Native American residency that you can provide care at. We currently have one of our first students that is going to go there. One of them is in Idaho and the other one is in Alaska. So we were also trying to grow that opportunity for students. So as you can see, there's a lot of different options as you continue into your chiropractic experience here at UWS. And I'm always here to answer any questions too. My contact is online. And finally, in quarter 12 is when you would do your preceptor experience. So that can be anywhere in the world that you choose. If you're going to live in a location, or if you're going to practice with a certain doctor, you can spend your final 12th quarter with that preceptor and learn their practice, get to know their patients, or you can do one in a location where you don't know that anybody and see what you can learn about a different style or technique of practice.
Thank you so much, Dr. Bergstrom. Yeah, so that is a really great opportunity. 12th quarter is a great way to test out a clinic before you sign a contract, or maybe learn about a certain practice model, or get to know a certain patient population. If you're thinking about working in pediatrics or in women's health or sports rehab, it's a great chance to kind of explore that before you either start your own practice or join one. So hopefully everyone does that opportunity. It looks like we have a question for you, Dr. Bergstrom. If you hope to do the VA route, which is the Veterans Administration Hospital route, would that be considered your preceptor?
It can run into preceptor. Yep. They normally like to have a student there for 6 months because it's a process to train and to get you there. So yes, that can carry into your preceptor.
Great. And you mentioned that they could start it a bit earlier, so not in 12th quarter, but maybe 10th or 11th and continue it?
Yep. Mm-hmm.
Excellent. So I have a couple questions for you, but for the audience, if anyone else has a question, you're more than welcome to post it either with your name or anonymously, and we'll be happy to answer as many as we can today. So Dr. Bergstrom, the questions I have for you, the first one is, what do students typically find challenging when they first transition into the clinic, and what resources are available to support them?
Yeah, I think the most challenging aspect is putting it all together. Like, you've learned these parts of history, you learn these parts of exam, you've learned all these adjustive techniques, but then when you get into the room with an actual patient, you all of a sudden wonder if you actually learned all of it at one, So I think that the most problematic that I see, and our student on with us today, Heather, can probably speak about that a little bit too, but that's kind of what I see. As far as resources, there's definitely options for you meet with your clinician to practice. We have also, we call it the CSEC, which I'm sorry, I can't even think of what it stands for right now, but that provides you with an opportunity to meet with a teaching assistant and a clinician and go through and work on whatever you feel your faults are, or not your faults, but your what you need improvement on. There's also clubs. There's adjusting club, rehab clubs that you can join and then practice that way as well.
Excellent. Thank you so much. I know we were talking a little bit about a supervising clinician. I shared that photo that had all of the clinicians in our campus health center that supervise students, and obviously you oversee everything. So what does that role look like, and how do students interact with their supervising clinician?
Yeah, so you will be assigned to a clinician at the beginning or at the mid quarter 7 time. At that point, then when you come in quarter 8, you'll start with that clinician in your pod. In quarter 8, it's a 5-hour per week course, and you will just go spend the time with that clinician. The first week is a lot of learning. They'll watch your adjusting skills. You'll take it's called the clinical entrance assessment. You'll take this exam. They get to see your history, your exam, how, what skills that they can help with, what you're really good at. Throughout the quarter, there's also case conferences on a Thursday that they take this time. It's an hour, and they can work with different, whether it's learning the modalities, learning more adjustive techniques, learning rehab, any of the assignments that are due in quarter 8, because there are a couple, orientating you to them as well.
Excellent. So this is kind of a funny question, but what is the most common patient issue or reason for visiting the UWS campus clinic that you've seen?
I think really it's low back pain, neck pain. I think we're in a world of a lot of technology, so we spend a lot of time on our phones, on the computers, bad posture. We see a lot of the students come in for care as well, and so you're young, and it's a lot of sport injuries or working out injuries, so we try to help with that as well. But a lot of it's just regular neck and low back pain.
Okay. Well, it's nice that it's that focused. What therapies and modalities do our students use in the clinic? So I know
Yeah.
they're exposed to a lot of them, but I guess what are the more common ones?
Currently, the most common modality used right now is a class 4 laser. It's becoming much more popular around even the Portland metro area. It's an expensive device, so we're very fortunate to have it, but we are helping a lot of patients with conditions that just were not, that nothing else was really helping them. They're not responding well. And that has been one of probably the most popular that's used right now. Like I said, we have the other ones, but soft tissue and probably the class 4 laser are most common.
Okay. And my last question for you, if we don't have any more questions from our audience, do you have any advice for our incoming students before they join the program or the clinic?
My advice is just, UWS is a very good school. Research others too. I think it's important to get to know the areas and where you want to go, but I think to prepare yourself, kind of have a background in medicine and, I guess we have a lot of students that have never been to a chiropractor, never been adjusted before, don't know a lot about it, and they're great. It works out super, but go shadow, go, find a few professions that you have interest in, go shadow them, and then come here. Because honestly, this is really we produce a lot of really great students out of UWS.
Thank you so much, Dr. Bergstrom. Does anyone else have any last minute questions for her before we say goodbye? Okay, well then, thank you so much, Dr. Bergstrom. Our next presenter is actually going to be a current student who's in her 12th quarter, Heather Portis. She's joined us to help answer questions that you might have for a current student in the clinic. Again, she's in her final quarter, so I'm going to start by introducing her and then asking her a few questions, but if you have any, feel free to post them in the Q&A chat, either anonymously or with your name, and we'll be happy to answer as many as we can. So Heather, if you don't mind, just letting us know again what quarter you're in, where you moved to Portland from, and what your undergraduate major was.
Sure. It's nice to see everybody today. So again, my name is Heather Portis. I am in my 12th quarter, so I'm due to graduate in a few weeks. Very excited about that. I moved to Portland from Northern California. I am probably of the unique kind of student set. I had a professional career before coming in, even to chiropractic college. So I worked actually in the business community. So I have an undergraduate business degree. So if there's anybody on this call who does not have a medical background, it is doable and achievable. But it's been a great transition for me and I've really enjoyed it. And I looked around at other schools and really settled on UWS because of its commitment to a high quality education, because of the interdisciplinary connections we have to other medical professionals and trying to provide a whole healthcare for our patients. And that's really why I chose to come here to UWS.
Thank you, Heather. Can you please talk about your transition from your lower quarter academic courses where it's just lectures and labs versus when you started your clinical portion of the program? Did you feel prepared? If so, what helped to prepare you?
So I think what is the most helpful was I started coming into clinic as a younger quarter student or as an earlier quarter just to experience what it was like and learning from the students and asking them questions and really trying to establish connections with other students in the community and ask them, you know, what to do, how to even be in clinic and what to expect. And so I think really engaging in that experience even before I was on the student intern side was really beneficial. And then just realizing that we did a lot of classes. We learned a lot of different adjustive techniques. We learned a lot of different procedures to work with our patients. And to know that we're not going to remember all of them when we get in. It's a lot, but what your clinician is there to do is to help support you and to help you remember those things and help guide you in your flow and what things to ask your patients, what tests to perform with them, and also, again, utilizing your upper quarter students. When you enter into the clinic, usually you'll be paired with an upper quarter student who may just be 1 or 2 quarters ahead of you, but they're there also to offer you support. And most all of our patients and everybody who comes in knows that we're a teaching institution. So a lot of people are very patient and are very open to you asking questions and, you know, really understanding that we're here to learn and just being okay with continuing to learn because you're not expected to know everything when you walk into clinic. It's a learning experience.
Well, on that same note, what did you learn during your first term in the clinic? Was there anything unique that you learned and that you remember?
I think I learned to be more confident in the things that I had learned in class, that it would all come back. And it's a combination of learning to type while you talk because you're taking a history with a patient, but really working on that in patient engagement and how to, you practice a lot with your peers and your classmates, but transitioning from being a peer and a classmate to actually being a provider of care. And so I think that's a big transition for a lot of people.
It does sound like a challenging one. So kind of related, can you tell us about the standardized patient assessments and how those supported your clinical training?
Actually, the standardized patient assessments do a lot to support and help you get into that mindset of being, of treating patients and working with people. And it helps from everything to working in the clinic to, I just took my Part 4 boards. A lot of you aren't going to be familiar with the boards process, but the very last board examination you take is a practical where you are working on a lot of standardized patients under the supervision of a doctor that you've never seen or met before. So it not only supports your learning, but it supports your testing and everything you have to do to graduate and become licensed. But it really gets you into practice of how you're going to ask your questions, where you're going to stand, telling people what you're going to do. And it's a good place, again, to make mistakes because you'll get feedback immediately from that patient as well as whoever the doctor that's in there supervising you. And all of it is meant to be positive feedback to help you learn and to grow. And it is the place to make your mistakes and figure out what works for you.
Excellent. So I'm glad to hear that that was a good experience for you and supported your learning. So I realize you're in 12th quarter and it looks like you're on our campus in the campus health clinic. What other clinical rotation options did you choose, if any? Did you do a CVI or a VA hospital rotation or anything else?
I was very interested in the VA rotation option. I did interview for it. It's a very competitive track, and I had some amazing classmates that were able to secure those positions. So they continued in to do those VA. I did apply for a internship here with Dr. Moreau that Dr. Bergstrom did discuss. So that was also an application process. So I applied, interviewed, and was accepted to work with Dr. Moreau. And so I did a portion of my 9th quarter as well as my 10th and 11th quarters here. And then I chose the option to stay on for my 12th quarter as preceptor. It is not a requirement when you, if you're accepted into the program to work with Dr. Moreau. I do have other peers who I worked with through 9, 10, and 11 who opted to go back to an alternate clinic like Dr. Bergstrom was speaking, where they were intending on practicing or where they just wanted to try living for 3 months and having that experience to see if they enjoyed it. But I did choose the opportunity to work here with Dr. Moreau for my final quarter.
Awesome. So what has that experience been like? Have you seen really interesting cases? Has there been any unique challenges that you didn't experience earlier in the other portions of your clinical training?
Yes, absolutely. As Dr. Berkshire mentioned, working with Dr. Moreau, we see some more complicated patients and some things that I honestly didn't think that I would see and really enforced the training that we received here, both with the clinic and that I received with Dr. Moreau. One of the most complicated cases that came to mind was we had a patient who it was somebody who we were seeing regularly and actually ended up having a stroke and wasn't sure if she was having like neck and arm pain that was something that we could treat, or I was having a more serious condition, and unfortunately it was more serious. But with the training that I received, I was able to recognize that, work with Dr. Moreau to get her the immediate care she needed. And I didn't think I'd be doing this on a regular basis. Obviously, it was Dr. Moreau that made the referral, but we referred her to the emergency room where she got the care that she needed. So that was something that I never thought I would experience, but it was. And with the training here, I was able to manage that and feel comfortable that I knew what to do and who to get for help. So that's a very extreme case. I won't say that that happens very often, but we've had also the opportunity here to work with patients that have postural orthostatic tachycardia syndrome, which is called POTS. It's previously thought to be a non-treatable condition. So for those students that are on, you can go look it up. I will honestly say I did not know what it was before I started working with it here, but it's a combination of some chiropractic treatment as well as some rehabilitation treatment for patients. And we're seeing great success with that. So it's really great to be on kind of the cutting edge of some science and treatment for patients that's really make a difference in their lives.
Oh, it sounds like you're definitely getting experience working in kind of an interprofessional team, like knowing who to refer patients out to and when. Like,
absolutely.
Did you find that challenging initially, or was it pretty seamless?
I feel like I've become more comfortable with it as we've progressed through, because all of the clinicians here are really great mentors, and you learn a little bit from every clinician that you work with. And I've also gone back to some of my professors that have taught classes that are all doctors and spoken with them if I've had a question, if I know they have experience. We also, we just have some really knowledgeable people here at the school that we can all tap into for resources. And they're all always willing to help, even if you're no longer in their class, even if it's a clinician that you don't report to, everybody's happy to support your learning and answer any questions that you have.
I can see that. Dr. LeFay and Dr. Partner come to mind right now.
Yes, absolutely.
So let me ask you, what is your favorite treatment modality? Like if you had like a go-to, what would it be?
I'll have to jump on the class 4 bandwagon that Dr. Bergstrom was talking about. That and the extracorporeal shockwave that we've been using it's been amazing to see how quickly we've had results for people with the extracorporeal shockwave who've had long-term pain, long-term conditions, and within a few weeks, they're feeling better. And even actually for some folks after the first treatment, they're feeling a difference in change. And then with the laser being able to really help acute injuries in a lot of cases and helping people to heal faster than they thought they would have been. And treatment for conditions like tinnitus, so for those of you who don't know what that is, for ringing in the ears, and people who've lived with that chronic condition for 20 years, and they're noticing a change in that. And so we all know how hearing impacts our lives, and to be able to make that impact for people has been really amazing. So knowing there's a lot of things that we can do with our hands and adjustments and soft tissue, I really enjoy that. But having these other tools at our disposal to really make a difference in patients' lives has been amazing.
Wow, I'm so glad to hear that you're able to see such an immediate impact on patients. Since you are in your last quarter, I have to ask, what do you envision for your future practice? And, you know, how did your clinic experience here at UWS help prepare you for that specific practice that you have in mind?
My goal is to work in an interdisciplinary clinic. So looking at clinics that not only have chiropractors, but maybe acupuncturists, massage therapists, maybe naturopath doctors as well. Those are a lot of fields and professions and physical therapists that we really work well in conjunction with. And also the medical profession and medical doctors. So really joining a multidisciplinary clinic where patients don't have to be shifted around, they can get the care and the treatment they need in one location and have a cohesive care package to that. I think being exposed to a variety of professors, we have some great naturopath doctors that teach some of our classes. We have a few medical doctors that teach classes. So seeing those connections even within the classroom and how much they appreciate what we do and vice versa has really taught me a lot. So wanting to be engaged in that area.
Oh, wow. Well, I'm sure that you're going to find the perfect clinic if you don't end up starting your own. Did you have any additional tips or advice for students who are considering our program or who maybe are planning to join this winter and thinking about their training at UWS?
I think my tips is take it one day at a time. It is a challenging program. It is a rigorous program, but it is all achievable because of the support that's there. You just have to ask for it and just reach out to everybody. Students are all very supportive. Faculty is all very supportive. And also, find your joy that's outside of school. And I think that applies to any work or any school that you go to if it's not here. Whatever that is, enjoy the environment around you, enjoy Portland, the Pacific Northwest. There's a cool and amazing community around here. So engage in that and have an outlet that's outside of this, because as wonderful as everything is here, you need a little bit of a mental break. That's an excellent thing to do. So find your joy, passion, and keep it.
That's a really good point. And there is so much to do in the area and so many different like clubs and groups to join. Like you can definitely find it here in Portland.
Absolutely.
Do any of our attendees have any last minute questions for our student representative? If so, feel free to post them in the Q&A before we say goodbye to her. Anybody? Okay, well, Heather, thank you so much for joining us and for all of your information about your experience in the program and your future plans. It was really nice to see you. And if we have any prospective student questions that come our way, we will definitely forward them to you so that you can answer them directly. And for all of our attendees, if you do have any last minute questions, you can email them to admissions@uws.edu and we'll be sure to forward them on. The next portion of our presentation is actually an alumni video of her clinic. And Dr. Becca Bell is an alum who, during her final terms of the chiropractic program, she wanted exposure to working with athletic teams. And so she found a local chiropractor who was treating the professional soccer teams in the Portland metro area. And she did her 12th quarter with them. And now she's here on video to talk a little bit about her experience doing that.
Hi guys, I'm Dr. Rebecca Bell. I'm a sports chiropractor in Portland, Oregon. I started my journey to be a sports chiropractor all the way back in 2015 at University of Western States. I did a ton of job shadowing to determine that I wanted to be a chiropractor, and I landed on chiropractic out of some other job options in the medical field because I really wanted to help people conservatively live their healthiest life. I also had a major passion for sports as a college athlete myself, and it really drove me to want to work with athletes and people who participate in sport as a provider. I concurrently completed the sports medicine master's program while I was at University of Western States, which was a really good decision for me. I think it helped me land my job where I'm at currently, which is Element Wellness and Sports Rehabilitation in Portland, Oregon, and the team chiropractor for the NWSL Portland Thorns, which is the women's professional soccer team in Portland. So at Element, we have 4 chiropractors, 4 physical therapists, and a personal trainer and chiropractic assistant. Everybody kind of has their own niche and specialty, but there is a little bit of overlap. We all bounce ideas and knowledge off of each other all the time. We co-treat patients, and it works really well. So to accommodate that many people, we need a decent sized space. We've got a treatment room for everyone, a really neat gym space. So let me give you a tour around our clinic. So this is our front desk area. This is the beginning of Element Wellness and Sports Rehab. Coming in here, we've got our gym space. We use a couple Pilates reformers and a Pilates Cadillac. A couple of our providers are certified in Stop Pilates based rehab. This is our squat rack, pull-up bars, TRX, all the things you might need for rehab. This is Dr. Luke Haroldson. He's a chiropractor here at Element as well, and this is his treatment area that he's got going on here. Another chiropractic treatment room that Dr. Noah Goodwill practices out of. Got all the chiropractors on this side of the clinic. Got a cool little goal board here for our patients to write their goals on. Some more rehab equipment there. Another chiropractic office in here. Pretty cool. Another chiropractic treatment room here that I practice out of. Lots of space for rehab as well in here. And then we've got a couple PT treatment rooms, but I'll just show you one here. And got some storage space. You've seen all the most exciting stuff about our clinic. My favorite part of being a chiropractor is the fact that my job is never the same every day. It's always a surprise what you're going to get no matter what setting you're in, whether it's on the field with athletes, whether it's in the training room, whether it's in the clinic and in your treatment room. You really never know what's going to walk in the door, walk off the field. So it's always different and fun. It's never the same. I'm never just sitting at a desk bored all day. I'm moving around, I'm active, and I get to talk to people all day. So those are just a few of the things I really love about my job. Some of my future goals as a provider include getting my diplomate in sports medicine. I'm actually getting to take the test for that this weekend. There's a written portion. In June, I'll be taking a practical portion, and there's a research portion as well. So it's something I've been working on for a really long time. I've gained a ton of knowledge by doing it, and I hopefully will pass all of those, and I'm pretty excited about it. As far as in my practice, I hope to continue to grow my concussion patient base. Not that I hope people get concussions, but I've done a lot of my continuing education studies there. So I really enjoy treating that population conservatively. It's been fun, and I hope to continue to grow that going forward. For any of you future aspiring sports chiropractors that want to do something similar to what I do in your future, I totally recommend finding a place where you love your job and that you're happy, because first and foremost, that's the most important thing. Secondly, if you do want to do something similar as far as the sports medicine field goes, get some extra education in that realm, whether it be your master's in sports medicine, your CCSP, or a diplomate, something that gives you that knowledge where you can be a team doctor and you have the tools to do so. Networking, also super, super important. Building those relationships while you're in school can be hard because the program is pretty rigorous, but if you prioritize networking and building relationships with people while you're in school, it will pay off when you're done. It paid off in this opportunity for me. I was so lucky to meet my current boss and be given the opportunity that I am now. But if I had not been actively trying to network and build those relationships, that wouldn't have happened. So also an important part of getting the job that you want in the future is networking.
Okay, so hi, my name is Dr. Noah Goodwill, and I am a sports chiropractor. I've been in practice since 2002, and I started this practice with my wife, who's a physical therapist, in 2005. So together in the last 16 years, we've developed a physical therapy and chiropractic clinic that largely specializes in both acute and subacute, but also chronic pain. I've been a sports chiropractor since 2006 or 7. I have to go back. And I have been working with the Portland Timbers since 2013 and the Portland Thorns since 2014. We really enjoy kind of a multidisciplinary approach and a holistic approach to treating. What got me into this was just your basic sports injuries. And since then, we've really enjoyed treating patients that have not just sports injuries, but just kind of your general typical weekend warrior, and of course the chronic injuries as well. We are blessed to work with fantastic physicians that are chiropractors as well as physical therapists. And the knowledge that we share with each other just makes every day that much better. We love coming to work, and I love sharing my time with both my patients and my coworkers.
Great. So I hope that video was helpful so that you could get to know an alum and learn a little bit about their practice. I thank you so much for attending. And if anyone does have a last minute question, you can email admissions@uws.edu and we'll be happy to respond. Thank you so much and have a great day.